The topic of fats in the diet is especially important for seniors over 60 because fat intake directly impacts cardiovascular, health, brain function, inflammation, and overall longevity. While fats are essential nutrients providing energy and supporting cell membranes and hormone production, not all fats are created equal. Some fats are detrimental and increase the risk of heart disease, stroke, and cognitive decline. Others are beneficial in helping reduce inflammation, improve cholesterol profiles, and support brain health. In this discussion, we will examine four types of fats that seniors should completely avoid and four types they should incorporate daily for optimal health. The first harmful fat is trans fat. These artificially created fats are commonly found in processed and fried foods, margarine baked goods, and fast food. Trans fats increase LDL cholesterol and decrease HDL cholesterol, raising the risk of heart disease and stroke. They also promote systemic inflammation and insulin resistance. Despite regulations reducing trans fat use, many packaged foods still contain hidden trans fats. Seniors should meticulously read food labels and avoid anything listing partially hydrogenated oils. The second fat to avoid is excessive saturated fat, especially from processed meats and high-fat dairy products. While some saturated fat from natural sources may be acceptable in moderation, excessive intake can raise cholesterol and promote inflammation. Processed meats like sausages and bacon often contain preservatives and additives that compound these risks. Third are omega-6 polyunsaturated fats when consumed in large amounts relative to omega-3s. Found in many vegetable oils like corn, soybean, and sunflower oils, excessive omega-6 intake can fuel inflammation if not balanced with omega-3 consumption. Seniors often consume far too much omega-6 from processed foods. Fourth are refined oils and fats subjected to high heat and chemical processing. These oils, such as certain vegetable oils and shortening, contain oxidized lipids that damage blood vessels and increase inflammation. Conversely, seniors should include healthy fats, such as monounsaturated fats found in olive oil and avocados. These fats improve cholesterol balance and reduce cardiovascular risk. Omega-3 fats from fatty fish, flaxseed, and walnuts are crucial for brain and heart health and have anti-inflammatory properties. Medium-chain triglycerides from coconut oil provide quick energy and support metabolism. Finally, polyunsaturated fats from sources like nuts and seeds support cell membrane health and reduce inflammation. By understanding which fats to avoid and which to prioritize, seniors can protect their hearts, brains, and joints while enhancing energy and longevity. In the next section, we will begin by detailing the first harmful fat type and how to identify and avoid it effectively. The first type of harmful fat that seniors should avoid is trans fat. Trans fats are artificially created fats that are commonly found in processed foods, baked goods, fried items, margarine, and many fast food products. These fats are produced through an industrial process called hydrogenation, which solidifies liquid oils to extend shelf life and improve texture. Despite their widespread use, trans fats have been shown to significantly increase the risk of heart disease and stroke by raising LDL bad cholesterol levels while lowering HDL good cholesterol. Furthermore, trans fats promote systemic inflammation and insulin resistance, which are detrimental to overall health and particularly harmful to aging individuals. Trans fats have also been linked to increased risk of diabetes, cognitive decline, and obesity. Many countries have imposed regulations to reduce or ban trans fats in food products. However, they can still be found in some processed and packaged foods, often under the label partially hydrogenated oils. Seniors need to be vigilant in reading food labels and avoiding any products containing trans fats. Consuming trans fats regularly can undo the benefits of a healthy diet, increase arterial plaque buildup, and accelerate the aging process of the cardiovascular system. Eliminating trans fats from the diet is one of the most important steps seniors can take to protect their heart health, reduce inflammation, and maintain muscle and joint function. By choosing fresh whole foods and cooking at home, seniors can minimize exposure to trans fats and promote long-term well-being. Saturated fat is the second type of fat that seniors should carefully limit or avoid to maintain optimal health. Found primarily in animal products such as fatty cuts of meat, full-fat dairy, butter, cheese, and processed meats like sausages and bacon, and saturated fat has long been associated with increased risk of cardiovascular disease. Unlike unsaturated fats, saturated fats can raise levels of LDL cholesterol, which contributes to plaque buildup in arteries and heightens the risk of heart attacks and strokes. For seniors who are already at elevated risk for heart disease, controlling saturated fat intake is crucial. Excessive consumption of saturated fat also promotes inflammation, which can exacerbate joint pain and muscle weakness common in aging individuals. Moreover, many processed foods high in saturated fats contain additives and preservatives that further harm overall health. Recent research suggests that not all saturated fats have the same impact. However, moderation remains key, especially when it comes from processed and high-fat animal sources. Health guidelines recommend limiting saturated fat intake to less than 10% of daily calories, with some experts advising even stricter limits for older adults with existing heart conditions. Alternatives like lean cuts of meat, low-fat dairy products, and plant-based protein sources provide essential nutrients without the negative effects of saturated fats. Cooking methods also matter. Baking, grilling, or steaming are preferable to frying in saturated fat-rich oils. By reducing saturated fat consumption and choosing healthier fats, seniors can lower inflammation, improve cholesterol profiles, and support better muscle and joint health. Education about food labels and ingredient lists helps identify hidden sources of saturated fat, enabling more informed dietary choices. Combined with regular physical activity and other healthy habits, managing saturated fat intake is an essential component of a heart-healthy lifestyle for older adults. Seniors should consult healthcare professionals or dietitians to personalize their fat intake based on individual health needs and risk factors. In summary, while some saturated fat is unavoidable, minimizing intake, particularly from processed and fatty animal products, is critical to reduce cardiovascular risk and promote musculoskeletal health as we age. Omega-6 polyunsaturated fatty acids are essential fats that play a vital role in brain function and normal growth and development. However, when consumed in excessive amounts relative to omega-3 fatty acids, they can promote inflammation, which is detrimental, especially for seniors who are more susceptible to chronic inflammatory conditions such as arthritis, cardiovascular disease, and neurodegenerative disorders. Common sources of omega-6 fats include vegetable oils like corn, soybean, sunflower, safflower, and cottonseed oils, which are widely used in processed foods and cooking. The modern Western diet often contains disproportionately high amounts of omega-6 fats compared to omega-3s, with some estimates suggesting ratios as high as 21:1, whereas a more balanced ratio closer to 4:1 or lower is considered optimal for health. This imbalance contributes to systemic inflammation and can exacerbate muscle weakness, joint pain, and cardiovascular issues in the elderly. Reducing omega-6 intake and increasing omega-3 consumption helps restore balance and reduces inflammatory markers. Seniors should aim to limit processed foods and vegetable oils rich in omega-6 and instead focus on whole foods with healthier fat profiles. Cooking with oils like extra virgin olive oil, avocado oil, or coconut oil, which have better fat balances and stability, is recommended. Understanding food labels and avoiding products with excessive omega-6 oils is also important. Some omega-6 fatty acids from natural sources like nuts and seeds are beneficial, but moderation and balance with omega-3s are key. Incorporating fatty fish flax seeds, chia seeds, and walnuts helps increase omega-3 intake, supporting muscle health and reducing inflammation. Healthcare professionals can provide personalized advice based on individual dietary habits and health status. Managing the omega-6 to omega-3 ratio is an essential aspect of a heart-healthy anti-inflammatory diet for seniors that promotes muscle strength, joint health, and overall vitality. Awareness and dietary adjustments can significantly impact aging healthfully and maintaining independence. Refined oils and oxidized fats represent another group of fats that seniors should avoid to maintain optimal health and muscle strength. These oils, often subjected to high heat and chemical processing, include many commonly used vegetable oils, such as soybean oil, corn oil, sunflower oil, and partially hydrogenated oils found in margarine and shortening. During the refining and heating processes, these oils can undergo oxidation, forming harmful compounds like trans fats, aldehydes, and free radicals that damage cells and tissues. Consuming oxidized fats increases systemic inflammation, promotes oxidative stress, and impairs endothelial function, which is crucial for healthy blood vessels and circulation. In seniors, chronic intake of oxidized fats accelerates cardiovascular disease progression, worsens joint pain, and impairs muscle repair. Furthermore, these fats contribute to insulin resistance and metabolic dysfunction, increasing the risk of diabetes and obesity. Foods fried in reused or overheated oils contain particularly high levels of oxidized fats and should be strictly avoided. Choosing unrefined cold-pressed oils, such as extra virgin olive oil, avocado oil, or coconut oil, can reduce exposure to harmful fats. Cooking methods that minimize oxidation, such as steaming, boiling, or baking, are preferable to frying or deep frying. Reading ingredient labels carefully to avoid partially hydrogenated oils and processed fats helps seniors make healthier dietary choices. Maintaining a diet low in refined and oxidized fats, while rich in antioxidants and anti-inflammatory nutrients, supports muscle health, reduces inflammation, and promotes longevity. Healthcare professionals can assist seniors in identifying hidden sources of harmful fats and tailoring their diets accordingly. Overall, avoiding refined oils and oxidized fats is essential for preserving cardiovascular health, muscle function, and quality of life in older adults. The first type of healthy fat that seniors should include in their diet is monounsaturated fat. Monounsaturated fats are found abundantly in foods such as olive oil, avocados, nuts, and seeds. These fats have been extensively studied and shown to improve heart health by lowering LDL cholesterol while maintaining or increasing HDL cholesterol. Unlike saturated and trans fats, monounsaturated fats reduce inflammation, which is critical for seniors dealing with joint pain, muscle weakness, and chronic diseases. Olive oil, a key component of the Mediterranean diet, is rich in antioxidants and has been linked to reduced risk of cardiovascular disease, improved insulin sensitivity, and enhanced cognitive function. Avocados provide a creamy texture along with fiber, vitamins, and minerals that support overall health and weight management. Nuts and seeds not only provide monounsaturated fats, but also contain protein, fiber, and micronutrients beneficial for muscle repair and immune support. Including these foods regularly helps seniors maintain healthy blood vessels, reduce oxidative stress, and support muscle strength and recovery. Cooking with monounsaturated fats rather than saturated or trans fats is recommended for preserving these health benefits. Practical ways to incorporate monounsaturated fats include drizzling olive oil on salads, snacking on a handful of nuts, or adding avocado slices to meals. Health professionals often recommend a daily intake of about 15 to 20% of total calories from monounsaturated fats for older adults. Embracing these fats as part of a balanced diet is a natural and effective strategy to enhance vitality and protect against age-related decline. Omega-3 fatty acids are a vital type of polyunsaturated fat that seniors should prioritize to support muscle strength, brain health, and cardiovascular function.